ordered a tiny scarf, a shamrock.
And
And Natalia was there and she came out of her bedroom with it on and she said, do you mind if I wear this to school? I said, nah, that's fine. I didn't have the heart to tell her.
I did not imply that. He said, we need to find out, and maybe you would like to work it.
Okay, I think he's ready.
I felt really implied that I had suggested.
It's what they do.
I know.
Yeah.
I know.
My best friend's birthday is today.
All right, Madam Chair, we're ready to go.
Fresh out of cards.
Hey, if everyone's ready, I'll call the meeting to order. I'll do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. First of all, I'd look for a motion for the March 17th, 2026 board meeting agenda.
Madam Chair, I'll move the agenda as presented.
Second?
Second.
Madam Chair, we do have one addition to the
Okay.
agenda, and that would be under my item. It would be a closed session pursuant to 13D05 subdivision 3B, attorney-client privilege to discuss matters related to a pending veterans preference hearing.
And we will put that under administrator's
Yes.
report. All right, anything else? If not, all in favor?
Aye.
Aye.
Opposed? Motion carries. Employee years of service. February. We have some employees here, 1 year, Health and Human Services, Jessica Jones, social worker. Veteran Service Officer, Tanner Eberling, Assistant Veterans VSO. 10 years, Health and Human Services, Jenny Crow, Public Health Nurse. Land Use, Teresa Leisure, GIS Technician. So we thank them all for their service, and they will be getting some awards, so thank you. All right, next we have the consent agenda. Mr.
Yes,
Andrew, would you like to go
today
through
we
it?
have
Mr. Andrew, I can't remember last name.
approval of the March 3rd board meeting minutes, approval of the Health and Human Services County and Hospital accounts payable, approval of the consumption display permit renewal for the Riverside Store and Tavern, a resolution designating commissioner to the Planning Commission, and approval of the 2026 Safe Assure Agreement. That is the consent agenda.
Does anybody have any questions? The Safe Assure is the same people we've used
Yes,
over the
for quite some
years.
time.
Okay,
Chair Oberg, make a motion to approve the consent agenda.
I'll second.
we have a motion and a second. Any more questions, discussion? All in favor?
Aye.
Opposed?
There's a
Motion-
resolution
Oh,
in
we
there.
have to have a roll call, sorry. There's a resolution.
Commissioner Johnson,
Yes.
Commissioner Van Ort,
Yes.
Commissioner Samke,
Yes.
Commissioner Schmidt,
Yes.
Commissioner Oberg.
Yes. Thank you. Thank you, Paul. I was looking right at that and forgot about it. Hospital Matters. Mary Ellen Wells and Tyler. And Tyler Youssef. Our CFO.
Good to see you all.
Good morning.
Good morning.
Thanks for having us. Couple of brief updates, and then Tyler's, also, we don't have financials. They haven't been approved by the board yet, so we're in a timing issue, but Tyler can give an overview of where we're at. A couple of updates. One, we have, as part of the building project, we had a first stage, which was to replace our pharmacy and move our pharmacy to the 2000 building, because the air handling systems are such that we're on a string to continue to have our certification. And so it happened all last year, the construction. It was finished in late October. We've been waiting for certification from the inspectors. The government shutdown delayed it by 12 weeks. And then we had a small item that was missing. That delayed it for another month. And the latest was, the state is so far behind, they brought in an inspector from San Antonio, a specialized area pharmacy and it was like his first or second inspection, and he miscalculated the size of the room for the air handling turnovers, and so we were corrected it late, after he had left. So we had to have them out again. So they came last week, everything looks good. We have to wait they took some tests of the air and microbes to make sure that there's no biological issues. So we're waiting on that. We should know by the end of the week. And then we can finally move in. We're looking at next week. Moving
Chair.
in. Go ahead.
I just want to say a couple of things. We all had an opportunity to tour their old pharmacy.
Yeah.
Can they still get in to see it prior to the opening, if they wanted to?
On the old pharmacy. The new one,
No, I don't want them to see, they've seen the old one.
okay,
Yeah.
I'll see, I'll check in with Dave if we can. I'm not sure.
It's a beautiful setup for them. I mean, it's entirely revised. Even the telephones are high-tech. Tyler gave me a tour, and from what they had to what they're going to,
Yeah.
yeah, super, super nice.
Yeah, it's an example of, we were able to recently recruit another pharmacist, and she was in awe of the new facilities. That's kind of what we're expecting with the new building. So can I segue into the building project?
Did I miss, how old was the old pharmacy?
Gosh, it's in the 1952 building.
Okay.
I
was
think
gonna
they
say
did,
older than we are.
Maybe they might have on one remodel. So this has been on our agenda since I've been on the board, just about 10 years at least. We were written up for exhaust hoods and
It's
the way
an
they
old-
had to operate. It was well overdue.
What it takes for producing the new drug compounds, and you have to be in a hood, and you stick your arms into this structure that has special air handling, and our air handling in the old facility couldn't do quite a few of the kinds of drugs that are mixed now. So we're going to be able to expand our, what we're offering in our infusion center, so people won't have to leave town like they have in the past. It's a big plus.
Good.
Questions, Amelia? Go ahead.
Okay, so the building, we are in the final stages of what's called design development, where they're deciding a lot of the specifics for every single square inch of space. We will wrap that up this week. It's been a very, I'll say inclusive process, and we're having every manager who's involved, they're gonna put their initials on the plans, which means they own it, and they're going to be responsible for implementing. But we've taken in so many of the input. Andrew heard this morning at Rotary, we even put in an exam room. We built an exam room outside of our conference area where the physicians could walk in, figure out where they want the exam table, the sink, the desk, and their computer. They could design exactly how they wanted the exam room. So that's gone well. Last night, we went to the city for final approval of the vacation of Lockerbie. We asked for a couple of variances. One of them was the height, and we granted that, and the other was parking, that we believe that 350 spaces, it looks like we need about 270. We're building 350. The old requirements and code required almost 500, and it's just not necessary. So they gave us a variance on that. We didn't know that there were two alleys under the 2009 building that were never vacated. And so they formally vacated those. Lots of details, but we're good to go now with the project from the city's perspective. Good. So we're expecting to switch into construction documents, and then those are what the RJM, our construction managing company, will then put out bids, and we'll get the solid final numbers, and then can start probably July. We'll break ground. Tyler can talk about the financing. We're in the final stages of, we're getting ready to put that out to bid and get bids from banks and financing agencies, looking at growth bonds with the backing of the county. But we are adamant that no tax dollars are being used. So things are going well. The preliminary, based on the design documents, the construction company is coming back and saying we're still well within budget.
Good.
We'll get the final when the construction documents are bid on.
Questions?
Okay,
Tyler?
Tyler, I'll let you guys finish.
okay.
I'll just talk about the financials a little bit. So, as Mary Ellen mentioned, the financial statements have not been presented to the hospital board yet. The reason being is we're waiting for the audit to complete. At the time of our last hospital board meeting, there were still too many unanswered questions at the end of the year. Now, a couple of those questions have become more clear. We're still going through our audit process, so it's not finalized audited financials yet. But I'll give you guys a little taste of how the end of the year did in 2025 and then the beginning of 26 so far. So the end of the year, 2025, we ended the year about 7% higher than budget on the revenue side as well as the expense side. So it's great to outpace budget on the revenue side. Ideally, obviously, we'd like to pare down that expense lower than 7% to gain a little bit more net income at the end of the day. But not all that surprising that we see that influx in expense as well. I think we're going to end the year after the audit around 2.5% to 3.5% operating margin. In addition to that, our investments have done pretty well this year, so that'll add a couple percentage points to our total margin as well. And then, again, all of this is subject to audit. And then we have two main adjustments upcoming. There's a para adjustment and then a cost report adjustment. The cost report adjustment is in our control and we're going through that process. The para adjustment is waiting for the state to come down with the level of funding that para is currently at or at the end of 2025 and then we adjust our liability from there. So we're a little bit in the dark on that adjustment, so we're just waiting. That should come the end of March. January revenue was $7.6 million, which is really good for us. Our high last year was $8 million in a month, so 7.6 in January. When deductibles refresh and everything refreshes on the health insurance side, 7.6 is great to see. February was 6.5. Generally, February is a little bit lower, just due to the amount of work days. And then we had an abnormal amount of providers sick during February, and so they were out for a couple days, and we had a couple vacations in there. So not alarming that February is lower. That's pretty typical. January is really the outlier there, pretty high one. And then the last piece on the financials, this is exciting for me anyway. I mentioned that the 7%, we were 7% over on revenues and 7% over on expenses. Ideally, we want to be 7% over on revenues, but 4 or 5% over on expenses, and that arbitrage can go to our bottom line. So, in order to help accomplish that in the future, we've developed new reports for all of our managers. And so I know you guys can't see this, but this is the level of detail that our managers will start receiving on a monthly basis. And so they'll really be able to dig down into their expenses and really control their expenses a lot better than they have in the past. Along with that, you guys will get a new format for a report. It won't be quite as detailed as this, but it should be much more helpful to you guys to get a better financial picture of the facility. Cool.
Good. Questions?
Well, I got two. One is, we're hearing a lot of talk through AMC on HCMC and the challenges we have there. Do any of those concerns or I should rephrase that. How do some of them concerns translate to Meeker County? And what, what does that look like on our horizon or current, where we're at financially and the future? I'm not looking for expertise or details, but
No,
in a broader picture, do we have anything to be overly concerned about here relative to that?
I'm concerned from being a part of the healthcare industry for the state. I'm concerned about one of our safety net hospitals struggling like they are. Will they go under? No. Will their services contract? Yes. We don't send a lot of patients, we don't refer a lot of patients to Hennepin. Typically, St. Cloud, Abbott Northwestern, and North Memorial. And North is struggling as well. So it will be interesting to see what happens with the county support and the state support, because it's not just a county facility. It's a state, people from all over the state referring, because it is one of the nation's best trauma centers. It's also a teaching hospital. So I watch with care, because I do believe its mission is one that we have to have sustained. Revenue won't support it. They're highly, their payer mix, their Medicare, Medicaid, government, TRICARE, they don't cover expenses, so they need tax support. And I do believe it shouldn't just be the county. It should be more broad, because lots of people all over the state go there. But we'll see.
Yeah.
I do know Dr. Croston, he's there as an interim. Wonderful, he's a general surgeon. He designed the current statewide trauma system. He was at North Memorial as their CEO and retired, and it's just called back into service. He's very strong, so it'll be interesting to see how they navigate.
Madam Chair?
Yes.
On the construction project, is there a end date in mind, completion date?
Yep, summer of 2028.
Okay,
So we're going to break ground this summer. It's 2 years.
okay.
I
2
thought we
years.
were shooting for groundbreaking in May, but we've already
Well,
moved that up a little.
Construction.
given the, and we're pleased that the inspection and will be done by
Right, that'll
the
make
county.
things faster.
It's still,
Yep.
Great.
Anything else? Steve, did you have another
Yeah,
question?
I'll be coming over, that's why I gotta leave here, I gotta go over
Okay.
and walk on the treadmill and do a
Good luck.
stress test. Whatever,
Give them my name when you go up. I just got done.
yeah, I should've.
Hopefully we don't elevate your stress today.
What do you mean that treadmill's still running when you, since you got off it?
Oh, I think they put the dye in you.
Yeah, that's what they do for us old people.
So,
you're coming to,
I'll be over at 10:15, I
all
got
right.
duffel bags in the truck.
Just in case.
You're going to put your body where your mouth is.
Any other questions? Anybody?
For me, that's probably real accurate.
Sometimes it just comes out, Mary Ellen. All right, well, thank you, guys. Good work. Good
Thank
job.
you.
Thanks.
Chair, if I may say one thing, Mary Ellen,
Just
thank you
ask.
very much. Mary Ellen and Phil Smalls came to, the Cedar Mills Township always has their meeting at 3:00 in the afternoon, their annual township meeting. And I had asked Mary Ellen and Phil if they would join me. And I think that was much appreciated by everyone that was there. It was a good turnout like always. And they talked a lot about roads and bridges, and Mary Ellen got to write about our hospital a little bit. So
Good.
Excellent.
just
Good
thank you
idea.
for that,
So,
appreciate it.
And
Thank you
if
for that.
you have an audience that might want a conversation, I'd be happy to join, so keep that in mind.
She told me she likes township meetings, so
Do.
there you have it.
Excellent.
Thank you.
Say, Matt. Yes. See the guest in the very back, Tim's got a hands are tied.
I know, do you want me to bring that to your attention? Actually, Chose,
Got more Irish.
Woodland Center's
That's it.
director.
Maybe that's it.
Good morning, how are you?
How are you? Sounds good.
Right on time.
Perfect.
Thank you all for having me today. I like to come every year and just talk about Woodland Centers, answer any questions you might have about us, but just about mental health and substance use generally, if you have any questions. So I did send a packet over, so hopefully you were able to get that. The first page of that really is our mission, our vision, our values, why we exist, what we do in the community. I'm not gonna review that, but more information for you all. Want to review our 2025 client data. We provided over 110,000 services across our area to 5,527 individuals, ranging in age from 3 to 90 in 2025. 82% of those clients we served were from our 7-county region, so the majority are from here. However, we serve 72 of the 87 Minnesota counties. That's a financial responsibility. So that might mean they're living in our community, but their financial responsibility is somewhere else because maybe they're in a group home, maybe they're traveling through, maybe they're staying with family in the summer, all those different reasons. But we see this number growing every year. Sometimes we serve people and then they move to college. We still serve them, even if they're not living in our region. So lots of reasons why that number is growing every year, but every year we see that going up. The two graphs here show the breakdown of clients by county. The first one is just the 7-county region. So you can see for Meeker County, if you look at the total of 4,535 clients, Meeker County was about 16% of all of those. The bottom graph shows all clients served, so even those that are outside of our 7-county region. And then when you take that into consideration, it's about 13% were Meeker County residents. So I just wanted to break it down two different ways.
So Ashley, if I may ask, is, you don't have to go back to slides then. Is, Candy, Ohio, of course, has a much greater portion. Is that solely based on, because their population is that much greater? Or is there more of a presence of woodland centers in Candy, Ohio County?
Yeah, so
Because if you look at Meeker, Renville, Swift, and Chip, they're all fairly close in their you know.
I think it is the population size, because for some of these pieces, so even if they're using crisis, for example, we took a look at the county financial responsibility, but it is right there in Candy, Ohio. So it's a little bit more accessible for folks because crisis is right there. So I think some of that can be determined by where the service takes place. Substance use services, for example, we have them located in Candy, Ohio, and we have them located in Chippewa. So folks want to attend those, if they want to be in person, you have to come to the office. A lot of that we're doing telehealth too, so it just depends on the service. But I think, yes, Candy, Ohio definitely, one has a bigger population, and some of the services are only located there. So, yeah, absolutely. As far as modalities, it's a great segue into modalities. So how do we deliver our services? We've been looking at this data since 2020 when everything changed for us, moving to telehealth. But as you can see over time, well, as we've been doing this over time, more services are continuing to be face-to-face. Our clients are requesting that. The services just tend to work better face-to-face. A lot of what we do is in the community. So we're seeing people in their homes, we're providing care in the community, and that just works better face-to-face. We do have some outliers. So things like psychiatry is actually the complete opposite. Only 27% of those services are happening face-to-face. Outpatient, so therapy services, only 34% are happening face-to-face. Adult day treatment has never come back to face-to-face. There's very little happening in adult day treatment. And that actually has been very beneficial because prior to COVID, only people that lived in, again, Candy, Ohio, or Chippewa were able to access that because it was all in person. Now we have people from everywhere accessing our day treatment programs, which has been helpful. And then we have substance use, which is about 51% face-to-face. So those are a couple of our outlier programs, but when you look at as a whole, a lot of our services are happening face-to-face. Questions on that? Telephone is very little. That tends to be an emergency situation. Somebody forgot their appointment. They can't access telehealth in that moment. They need something, we'll do some telehealth or some telephone, but it's like, as you can see, very, very little. I also put on here crisis bed days by year so you can see how that fluctuates for adult and youth crisis. The big increase in 2025 was because we added more beds. We had an addition of 1 youth bed and 2 adult beds that we added that year. And so, of course, with that, the utilization goes up. Part of that too is we were able to add individual rooms. So historically in a youth crisis, every room was shared. So at times we can only have 1 kid in that room because of their needs of, they might have trauma, they might be transgender, they might have age differences. So we can't have 2 kids in the same room. Now we have an individual room so we can move people around. We have more flexibility with the admissions that we have. And that has increased our ability to take more youth and adults.
If I may.
Yes.
I noticed 20 and 21, the youth was higher. And then it's a direct switch to adults from that point on. And now I see that we're very close again in 25. Anything that
Anything we can
triggered
point to
that?
Not necessarily,
Okay.
no. Not that I can think of in the moment, but it's a great question that we could dig into to see if there was anything triggering that. Not that I can think of.
Okay, thank you.
Yeah. The next 2 pieces are really looking at 2 of our specific programs. So Schooling Mental Health, we've been delivering this service for over a decade, probably 15 years, I want to say. We are in 15 different school districts, about 50 different buildings of those school districts. And we continue to provide more service in this program every year. So as you can see, the number of providers, this includes our skills workers, so like bachelor level folks, but also our clinicians are in this number of providers. So that number hasn't gone up significantly, even though we've added more schools, we're doing more services, but the number of clients served continues to go up. So part of what that means is that we're getting people into services faster and we're able to get them out faster. We're providing care. This tends to be a short-term service. So folks might come into schooling, they get service for 6 months, we discharge. So it's not meant to be a forever thing. None of our services are meant to be a forever thing. But schooling is also very nice because they can do really short, quick services, 30, 20-minute appointments in between some of their classes, or maybe in a class that isn't as vital to their ongoing education. Might be a study hall, might be gym class, something like that, so that we can pull them out of classes that won't interfere with them graduating. So there's pieces like that that we can do as well. So we might do more services and see them a little more often than maybe an outpatient. But you can see the number of services provided, again, has significantly increased year after year. So schooling is a really important program for us, really vital. And then we have outpatient services. I wanted to put this graph on there. Wanted to show you the difference a little bit between schooling and outpatient, but I also wanted to highlight that we do not have 63, so between 36 and 63, that doesn't mean it's all outpatient providers. Some of our schooling providers might do some services in outpatient, like in the summer, when it's a little slower, they might come do some service. So this might not be exclusively outpatient providers, it might be providers from other programs coming in to just help us with some services. I think that's an important distinction. But this just shows you the number of providers over the year. The next page shows a little bit about their services and the comp evals. And as you can see, in 2020, our services went through the roof. Unfortunately, in a crisis situation, in a very bad economic time, we tend to get busier. And COVID was one of those times. People were sad, people were anxious, people were worried. We tend to see more people during those times. And then, we've kind of leveled off since that time as far as services go. The other thing to point out is the number of comp evals. This is what gets people in our door. So a diagnostic assessment, if you're in a different world, sometimes that's what we call them. You can see in 2022, we had the highest number of comp evals ever. Part of that was that's the year we became a CCBHC. So every open client had to have a comp eval. And then it kind of goes backwards a little bit from there. Part of that is because we changed the legislation. So instead of having to have a comp eval annually for every single client, which felt redundant and not very useful, we've changed it so that it has to be as needed when it's clinically relevant. So for us, it's every 5 years minimally. Sometimes it's annually still for somebody who needs that. But that's allowed us to have more flexibility. So when you see some of the numbers like 2025, that's probably new clients coming in our door versus the 2022 number, which is a combination of new clients and previous clients needing an update. Does that make sense? Do you guys have any questions? Any of that data? All right, some updates from us. We have been implementing implementing AI since August of 2024. The AI that we have sits in the background of therapy sessions and honestly some of our community-based sessions and just helps us with our note-taking. So it's really like a secretary for every one of our staff members that they can bring with them and help them with their documentation. It's been utilized by 114 of our staff. It's generated over almost 53,000 notes, and this is a little bit old, so it's probably more than that by this point. And 58% of those are live sessions, meaning it's sitting in the background, is listening. The other option we have is if you're in the community, maybe you can't do a live session, they can type in like 6 bullet points of what happened, and then it will help generate a note for them. And that's what we call the text version. So typically for us, it takes about 15 minutes per session to do a note. That's just the industry average. Our average with using Elios has gone down to 4.28 minutes. So significant time savings for every single staff member. So it's about 7,000 hours of time savings. Pretty significant. Which means we're seeing more clients, which means honestly for our staff, it's work-life balance. Most of our staff were taking their notes home. They were sitting on their couch at night doing their notes. And so they don't have to do that anymore, which is huge because there's a lot of burnout in our field. I'm sure you are aware.
Again, if I may. AI, if they're using it for note-taking, do your providers find tends to remind them of something they forgot? Because if they've seen 4 clients, 5 clients during the day, it would seem to me as a person, you'd start to get some of that mixed up in your mind.
Absolutely. As a clinician myself, at the end of the day, I would do my 8-9 notes and be like, oh, right? You might miss something or do a little more vague because you're like, oh man, what did happen at 8 a.m., right? Like what were the details? And so unless you have really good notes that you're taking, it can get a little more vague. So the AI definitely picks up on things that maybe you didn't pick up on. And the nice part is you can go in and edit it, right? You don't just take it at face value. You go in and you review it, and it does kind of trigger some like, oh yes, yep, that's exactly what happened, or oh, I need to edit this language. But it's very helpful, and our staff have said, please don't ever say this way. Please don't ever lose this. This is the one thing that this has made such a big difference for them in their work-life balance. And the notes are really nice, really nice.
you.
Madam Chair,
Yes.
do your clients have to sign anything that
They
gives
don't.
permission for that, or is it just part of the process?
Just part of the process. It's in our consent for services. Most of our staff do let clients know, like, hey, we are using AI to help with notes. If that's a problem, we can turn it off. But most of them are used to it at this point. It's such common practice. Because it's not actually recording anything, there's no need to have consent. If we were recording and it was having a transcription of what was occurring, that's a different piece, but it's not recording, it's just summarizing.
Gotcha.
And then all that data is gone at the end of the note.
Thank you.
Yeah. All right, outcomes. This is an important piece. It's part of what we've been working towards, I feel like forever in behavioral health, but at Woodland Centers specifically, we really want to be able to show that what we're doing is working. I think we can anecdotally, we always feel like, yes, what we're doing is helpful. We're helping people get better. But what are the numbers, right? Like, how can we show those outcomes? So we started measurement-based care, which essentially is helping people we assess people when they start services, and then we assess them along the way to see, are you getting better? So if you've been to the doctor, you've taken the PHQ-9. It's the 9-question survey that says, you've been feeling down, depressed, or hopeless in the last 2 weeks. Have you had any problems with sleep in the last 2 weeks? Everybody fills this out. We have our clients fill that out too. So when we take we have lots of assessments that we're doing, but that's just one of the examples. So we really wanted to do this, one, for good client care, 2, to help us with our treatment planning, because if something's not working, that should tell us, and we have to adjust. So we've implemented this in 2024 as well. So in 2025, we had 26,000 assessments completed by our automated system. That's a lot of assessments sent out to clients. 92% of all clients completed at least one assessment. That's a pretty big number. In 2025, we attempted to collect 5,322 social determinants of health screeners. So we don't screen just for mental health, we screen also for physical health symptoms, and then also for social determinants of health. So We know if you have depression, we can throw depression care at you all day long. If you don't have anywhere to live or you don't have any food, that depression care is probably not going to be very effective. So we look at not just the PHQ-9 depression measure, we look at what else is going on for this person. And so this is a really important measure that we have across our clients to help determine what else is happening. And 98% of the time, our clients are filling this out, so we have really good data. When we look at depression outcomes, 42% of clients that had mild to severe depression showed clinical improvements. So what we were doing was working. And 19% reached full remission, meaning they didn't need our care. Yeah, that's huge. We want that number to grow, but it's a good start. And then when we look at anxiety, almost 50% of clients showed clinical improvements, and 25% reached full remission. Depression and anxiety are 1 and 2 diagnoses for us. It's what we see most of our clients having. So this is really big outcomes for us. And then finally, 59% of clients with suicide risk showed reductions in their suicide severity. It's a mouthful. So those are big outcomes for us. Again, these are things we want to increase and show that we can make improvements over time. But it's one of the first times we've had these numbers, right? It's not just anecdotal saying, gosh, we're doing good work. So it's exciting for us to be able to show that. Is there any questions on that piece?
Madam Chair?
Yes.
So you note that 42.1% of clients with severe depressions showed improvement,
Yeah.
and 19% reached full remission. Is that 19% part of the 42%?
Yes.
Okay,
it would
thank
be.
you.
Yes.
Okay.
Yep. Any other questions? Okay. The other piece that we've been working on is zero suicide work, and I know this is something at Meeker County that everybody's working on too. We're actually very excited to be part of the Meeker County Zero Suicide Initiative here, but Woodland Centers has been working on this internally since 2021. And just to show you some of our results with this, there is a fidelity assessment that has 19 questions. It has a score of 1 to 5, so 5 being you're meeting full fidelity on these items. So when we initiated that project in 2021, our fidelity score was 33 out of 95. And in 2025, we got up to 65 out of 95. So we've shown significant improvements. And I think, again, it goes back to our measurement-based care, where when we screen somebody and we show somebody has some suicidal ideation, what are we doing to address that and to help mitigate those risks? So it's kind of a nice segue between the two to show that, yes, we've done some things as far as policy and procedure, but it's showing in the outcomes too. The next piece is just really our workforce and economic impact. Just to let you all know who we employ, we have about 240 staff across our 7-county region, and almost all of them live and work in our counties. And so we do have some contracted staff, about 4 of them, that live across the country. But the majority of our folks are people that live and work and do all of their things in our communities. At Woodland Centers, we have a $27 million operating budget. 13.5 of which is invested in salaries, and 5.7 is benefits. So the majority of our whole budget goes to our staff who live and work in our communities. So yeah, looks like you have a question. Go ahead.
May I?
Yes.
Your last sentence there says difficult to retain in rural communities. So you currently have a vacancy of 3%, 4% of your staff?
I don't have a number. I wish I did to be able to answer that.
I'm just,
But I would say we have vacancies in outpatient. We could use more clinicians. We always have vacancy in assertive community treatment, and that's a clinician as well. We've been trying to hire that for 3-4 years. It's the licensed clinicians where we struggle.
so do you think it's harder to recruit out here because the pay is that much better in the urban areas, or is
They're
it
just
lifestyle?
non-existent.
What's that?
They're just non-existent is the problem.
Okay.
Pay is part of it. I think sometimes people live in the metro because there's more to do, and so there's that piece too of how do you get people to want to live out here. Oftentimes it's family, it's friends, it's your community. A Marry a Farmer program, I still think it's a good idea. Like, how do we get more people to live out here? But I think, yeah, some of it is where did you grow up and what are you accustomed to? But there's just a lack of clinicians across the nation. This is not just a Minnesota Woodland Centers issue. It is everywhere.
National.
It is everywhere.
Okay, thank you.
We have more clinicians retiring out of the field than are coming in, unfortunately. And I'm sure that's not just our field, there's others too, but we're seeing it across our industry. Community impact and outreach. We participate in the Stingers Reading Program. And so what this is students about 45-mile radius from Wilmer, so all the schools in Meeker County are included in this. They take home a reading page 4 times, like for 4 weeks. And if they read for so many minutes those weeks, they get to turn that back into their classroom. And then they are eligible to win a free backpack from the Stingers, which we promote, put our stuff on it. And then inside that backpack is also some of our promotional materials. And then on each of the reading pages on the bottom, we also get to put our information. We usually put our crisis line. So for 4 weeks out of the year, almost every family in our region has, including in my house, has our information stuck to their fridge. So it's a really great promotional opportunity. And then students also get to go to a free Stingers game if they turn in all of these pieces. So together it's about 35,000 logo and promotional opportunities across our region. And it's a really great opportunity to partner not only with our schools, but with the Stingers. So it's been a really fun program. And I had some more data on that, and I keep forgetting to print it off and bring it with, specific to the schools. So if you're interested in that, I can certainly send that over so you can see that. And then in 2026, some of the things we have going on, we are initiating a new AI project. We are working with Meeker Health, which is a different AI company, to help us with our intake process and our comp eval process. Right now, people come in our doors for that initial comp eval, and it takes about 2 hours with the clinician to start that process. And we schedule that same day. So if you wanted it today, we schedule it today. Works for most people, but that's a 2-hour block of time. It's a big chunk of time. If you're a working person, that's hard to take time off. So what we're looking at is, can we have AI help us with that? Could it ask some of the questions that we don't need a clinician to ask, start the process, and then have a clinician come in on the backside and ask more of the questions that are clinical, the suicide risk questions, the homicidal risk questions, the clinical questions that can help us form diagnosis, treatment planning, those types of things. So that's what we're building right now. We're hoping to initiate that Q2 of this year. We can get everything up and running and tested. We're going to thoroughly test this because one of the pieces we want to make sure is that if somebody's indicating suicide or having those thoughts, that it will automatically trigger that person to go to our crisis line. So we want to test that. So that's one of the pieces that's coming this year.
When we were doing this, the board members had an opportunity to call the number and see how it went. And I think overall, we had some questions, but I think most of our concern was what Ashley just talked about, if it's somebody that's thinking about suicide or something, that they get moved on to a person. And so it's gonna be an interesting, and save us a lot of time, I think. So,
A lot of time, a lot of resources, so we can hopefully reallocate some of those resources to therapy. We have a waiting list right now of, I think, about 150 clients waiting for therapy. But we have a lot of time hung up in these comp eval processes, because as you can imagine, we have 10 to 12 comp evals every day, 2 hours a session. That's a lot of clinician time.
takes a lot of time.
A lot of time. And so if we can reduce that even by an hour, that would be huge for us to be able to do that and offer more services. We want to make sure it's effective and it's working. So we're looking at this as a pilot and really trying to vet out how to make it work effectively and not roll it out too fast or do anything that would be harmful to our clients. So it'll be a slow, steady process as we roll this out.
Madam Chair.
Yes.
So the Meeker Health, is that almost like a cooperative with?
It's actually an AI company. It's a nationwide AI company that we're partnering with.
Right, and so when you say partnering with, is that like
We're contracted.
you're helping them kind of refine their systems and
Great
with the
question.
data and all that?
Kind of a
Yeah, so
pilot
this would be
program for
brand
them.
new. This
Yeah.
would be pilot for them too. They've
Yeah.
not implemented this anywhere in the nation yet, so we would be their first test. So that, yes, so it would be almost that kind of partnership. And because of that, they have given us a good discount to be able to do this. Yeah,
We like that.
yes.
And they gave presentations to the board, and like I said, we had the opportunity to try it, so it's exciting. If it works, it's gonna be wonderful, so.
Yeah, yeah. The other thing that we're working with County Social Services on is May's Mental Health Month, and it's kind of a big deal for all of us to just promote mental wellness, and so we want to deliver a unified message across our 7 counties. It might mean different activities and different things that we're doing in the 7 counties, but it helps us deliver, that we're all united in supporting mental wellness, and we all have the same message that we're delivering, and here's the different activities that you can do in each of the counties. So we have Kim Madsen, our Community Impact Director, working on that messaging and sending that out to social services so we can deliver that across our region.
So,
That's a lot. So do you guys have any questions?
anyone? You don't have any questions, Paul?
I asked too many.
Checking with you. No, I'm kidding. Do you have questions?
No.
Anyone?
I was just gonna ask on, you said that 2025 bed numbers were up. Are we having, I mean, all we hear is that there's not enough beds, Are we having issues finding beds?
Yes, so, we
For
are
care.
a crisis unit, so we're a 3 to 5 day typical stay. We are not an inpatient hospitalization. So if somebody is needing psychiatric medication changes, that's probably not gonna work for us. If somebody is needing restraints, we don't do restraints. And so we do have that problem. When we have somebody that's beyond our capacity, we're often sending them to the ER. We actually just had Prairie St. John's up in Fargo come down, and they want to partner with us too. So when we have youth or adults that are not able to stay in our unit, how can we partner with Prairie to go directly to Prairie instead of sending them to the ER to then get to another hospital? So we're hoping to divert some of these folks from the ER when we're able to, but we are not that inpatient level of care. I think that where the bed shortages are really happening.
I think that problem has not gotten any better.
It has
Because there's just nowhere to put patients, and so if they're at crisis and, their alcohol level is too high, or they're combative, or Woodland is not for that, so they end up in an ER somewhere.
Yep,
So
yep.
that's a
I will say-
problem.
Go ahead, I'm sorry, Beth.
No, go ahead,
Yeah.
Ashley.
We are one of 2 youth crisis centers in the whole state. We are the oldest youth crisis center in the whole state. Olmsted County opened theirs in really mimicking ours about 3-4 years ago. Ours has been around since the 80s, I want to say 70s. It's because of our partnership with counties. Nobody else can figure out how to get a youth crisis center started or operational because there's no funding for it. Our counties have funded our youth crisis center, and we're hoping to get legislation through to help get an MA rate for that. DHS has promised that they would work on that. With everything going on, that
Yeah.
might take a little bit longer than we anticipate. But it's been a really important service in our region because it is a place for kids to go that don't need that inpatient level of care, but just can't stay home. And so it is a huge service in our region that I know others they've come and said, how do we do this? How does this work? And I'm like, first you need county support. Like, you need a funding source, you need people to help you build this. And we've been very fortunate to have that in our region.
I'm
And
guessing
it's
that's
out
still a
there.
topic at AMC, isn't it? I mean, it was 5 years ago or more, so it's just an issue.
Yep.
They need more spots, so.
Yeah.
Any other questions?
Well, thank you.
Thank
so
you,
much.
Ashley.
Thank you.
Thank you.
Any questions you have, please know I'm a resource for all of you, so, thank you.
Thank you.
Thanks.
Lisa Graffentine, Economic Development Director. Good morning.
Lisa Graffentine, the Meeker County DDA, and I'm here before you to request a modification to a SAHA request that we did last year for Habitat for Humanity. I do have the Executive Director of Habitat, just in case you have any questions on their specific program that I can't answer, so Kayla would be happy to answer any of those if they come up. I did provide a pretty detailed memo, so I won't go through all the information, but maybe just touch on a few highlights in terms of a brief kind of SAHA, which is statewide affordable housing aid, but we're gonna use SAHA to keep it short. I'll give a brief kind of overview of the SAHA and the purpose of that, and then talk a little bit about the modification request. So with SAHA in the 2023 legislature, they decided to provide aid to each county and every city over $10,000 to address 10,000 population to address affordable housing needs within the community. We found it was often difficult for greater Minnesota really to compete with some of the statewide dollars when you're competing against larger metro areas, maybe like Duluth, Rochester, and the Twin Cities. So it was really a way that we would be able to get some dollars to address the needs based on local decisions. And so those allocation dollars started in 2023. They were consistent the first 2 years, just over 100,000, and then it did drop in 2025, and then a slight boost there in 2026. With the SAHA funds, there's a variety of eligible uses for it. I would say the large buckets are really around affordable rental housing development, affordable homeownership opportunities, and within that, there's all sorts of categories. So you can use it for construction financing, home buyer gap financing, interest rate buy down, and in addition to the eligible categories, then there's also some additional requirements around income limits, accessibility based on size of projects, and so projects typically that work in the affordable housing field are probably already doing a lot of these requirements under the Minnesota housing programs that they might already be using. But in the end, we can do some limited market rate housing development as well, provided it meets certain criteria. But the goal was around kind of that new construction or preservation. That was the other kind of big bucket I forgot, is it can also work on preservation of affordable housing. So for instance, in support of like the county HRA, in rehabbing their units. Another project that the county has supported was the city of Litchfield's looking to do a new rental housing development as well. So those are a few of the projects that have been funded in the past. In terms of the Habitat for Humanity, the EDA started working with Habitat for Humanity a little over a year ago around their interest in expanding into Meeker County. So a lot of their efforts had been in Candy Ojai County, and they've really been doing some great outreach to some of the other counties within their region to talk about some opportunities to expand Habitat into those areas. They have a long history of providing that entry-level affordable homeownership opportunities to their clients. And then what they've been doing is kind of researching infill and bare lot opportunities within the community. So last year when we started the initial conversation, they were interested in building 5 homes over the course of 5 years in Litchfield. And then also, so then with that, on April 1st, 2025, the board did authorize funding in the amount of $45,000 for their project. And that was approved as a 0% deferred loan for 5 years to be used towards that land acquisition and home development. So think of it like that construction financing piece. And then they originally had planned to begin construction in 2025. Well, as they really dug into the bare lot piece, and I think kind of it maybe even came up in our conversation that there was a home on the market that might be a really good fit and kind of is exactly like the model that they use. And so they pivoted, and their first home is going to be working with that existing home that's on the market. And so then that changed their approach to go with more of a 4 homes over 4 years. Also in conversations, Kayla and I have had, again, many memos, conversations, emails. Come to find out, when she had originally talked to us, there were 2 parts to her request, and I think I had just kind of honed in on the construction financing piece. But her original request had 2 parts to it, both the construction financing and the home buyer gap assistance as well. And again, both of these are eligible under the SAHA program. And so the original request they came in with was that $105,000. So with kind of this, again, we've changed essentially, there's 3 kind of components we've changed. The amount of financing that they needed, and then the fact that they weren't starting anymore in 2025 and they were going from 5 homes to 4 homes. I will say that the first home that they're going to be working on, that is already a home that the EDA collaborated with that developer on, so there won't be any additional EDA assistance or SAHA funding that would go towards that home. So that's a project that, again, we've already collaborated with that project. So that'll be their first home that they'll do, and then they're going to look to start their first of the 4 homes in 2027. So work on that first one this year, and then the next 4 starting in 2027. So with the request, with it being a pretty large difference from what we first talked about, I did approach the EDA about this maybe being a collaborative partnership where it wouldn't necessarily all be funded with SAHA, but instead we would approach it with the EDA financing a portion of it and then using SAHA for a portion. Did discuss that with the EDA board, and they approved funding the construction loan in the amount of $45,000. And then we would look to change then the SAHA funding from construction financing to that affordable home buyer assistance in the amount of $60,000. And that would be structured at 0% as well. So none of these funds are going to be grant funds. They will come back at some point. The time is a little uncertain on home buyer gap assistance because that essentially stays there until either they pay off their mortgage or they sell the home, and then those funds would recycle. And just kind of for note too, like with the SAHA funding, when those funds recycle, they still remain SAHA restricted type funding. So none of those restrictions go away as those funds are repaid. So that is the request. So essentially, the changes that it would do is it would be an extra $15,000 from what you approved last year. It would be a change in the use from construction financing to home buyer gap financing, and then it would be 4 homes instead of the 5 homes. And just I'll kind of wrap up with the, kind of the why of, both like the EDA has gotten involved kind of in housing work. When I first started this, started working with the EDA back in 2019, a lot of my initial conversations were employers when I would ask them, how can the EDA support you? What are your needs? The top 3 things that would always come up, and this is pretty common, is, I need to find people, like I need to find workforce, and then when I find the weak workforce, I need to ensure they've got housing available within the community and they've got childcare. So a lot of our efforts really focus kind of on those 3 areas. And so that's when in 2020, we kind of started to do some of this housing work, and the EDA was very clear to say, we don't want to be a developer, but we want to collaborate with the private sector. And so all of the work that we've done in this type of a project too, is collaborating with community organizations and the private sector to create these projects. And just kind of from the work that's been done so far with the EDA, we've built over 118 housing units, and we've got 50 more that are either in the planning stage or have their funding and ready to start. A lot of those have been really focused on rental housing, so it's kind of exciting that, we're trying to, any opportunities that come up for home ownership, we're really excited about that, because we do want to create a balanced approach too, and as employers need housing, it's on all levels of the spectrum, all the way from affordable rental and homeownership opportunities up to market rate. So any way that we're kind of helping to create housing along that spectrum is good. And, one of the things I haven't finished yet, but I want to do is kind of just an economic impact analysis on this housing work that's done. I know I did start to pull, thinking about homeownership opportunities, the 10 units of new homes that we partnered with, I just kind of quick pulled some of the data there, and that's added just under $3 million of new market value to our community here, and just over $30,000 of new taxes. So there's great economic value that comes from some of these collaborations as well, in terms of adding new tax base and new taxes to the community as well. So with that, any questions on the
Questions, anyone?
I do have some questions. So when we build, so first of all, I really appreciate Habitat for Humanity. I've had opportunities to volunteer with them. I appreciate what they do. But that being said, for homeownership, entry-level homeownership, 300,000, which is the kind of the average 288, is what I would not consider entry-level in this area. So that's one concern I have. The other is there are so many programs available for people who are first-time homebuyers or entry-level. We have down payment assistance. We have FHA loans. We have USDA loans. Some require no down payment. We have VA loans. If you buy a house that needs work, there are rehab loans. There are a lot of government-funded already options available for homeowners. Here's my concern now in doing some research, and maybe these are Kayla questions as well. When you purchase a home with Habitat, your income needs to be less than the median income of the area. Our median income is $75,000. In order to, let's see, there was a lot of mathing, and so please correct me if I'm wrong. If you have 80% of the median income, which I believe is a Habitat requirement, you can, I think you can make about $60,000 per year, if I'm not. In order to qualify for any loan, your debt to income ratio can't be more than 40%. And so for that income level, to qualify for a loan for $300,000 is nearly impossible, because your debt and income, debt to income ratio, the amount of debt that you can have exceeds the amount of this mortgage payment. So I understand why you would need gap financing, but still, when I'm doing the math, what do you perceive the payment on a $300,000 house to be?
You want me to wait?
Yeah.
You guys will come, you can come back. Okay. To hear. You know, I'll let kind of, again, Kayla will be the one to be able to answer kind of how, because again, some of those programs are layered together, you know, that you mentioned.
Right, so you're doing multiple programs. Okay?
Good morning.
Morning.
I'm Kayla. I think I got to meet most of you last year when I came to present. So what they're passing around is just the numbers, because sometimes numbers on paper are a little easier to look at. So,
Absolutely.
Meeker County, you're correct. So 80% AMI is our threshold. So generally, we put families in them, and obviously every scenario is different. So in that case, 82.7, which is super close to what you said. And definitely loan to value comes into play. So we, on the first mortgage side of things, and I'm gonna explain this as easy as possible. So easy math, $300,000, which is the house we're talking about. So if they do USDA, and that's a buy down on the interest rate, so they can buy down to 1%. Generally, they can get approved for $200,000. So there's $100,000 missing piece of the puzzle there. So we step in with the subsidy for that portion, and we do a silent second. So when their first is paid off or they sell the home, then they would have to repay that at that point. This $15,000 we're talking about would also layer into that. So we'd step in for 85. You guys would hold 15, essentially. We fundraise for the family. So yes, it connects a bunch of programs together to make it possible. In our experience, it works. We stack the deck in closing. Lawyers love it to sit at the closing table and stack that deep. But unfortunately, there's not a huge, easy way around it. Affordable housing as it goes. I mean, these houses are not huge by any means. They're not super fancy, but that's what it costs to build today in the world that we live in. The house that we build, we kind of have, Habitat has parameters, so it's kind of this cookie cutter house, right? If you need a 3-bedroom house for the family, this is your floor plan. If you need a 4-bedroom house, this is kind of your floor plan. So just perspective-wise, that 1,200 square foot house in 2019 cost us $90,000 to build. In 2022, it cost us $250,000. Today, it appraises out at $314,000. Same house, same interior, same exterior, same everything.
So building a new home right now really isn't affordable housing.
Correct, yes.
Right, right. I would say as a realtor looking at the market right now, we have several houses, quite a few houses in the Meeker County area that would be affordable housing if they were to purchase those houses that are already existing. And so I have concerns about how this subsidizing and financing through multiple layers are affecting the rest of the market. So that's a concern I have. I also, over the course of 5 years, over the past 5 years, our interest rates have gone from affordable to double that. They were in less than 3%, now they are 6% if you have good credit. And so that is also a concern. How do we know over 5 years what the cost of building these homes will even be? Because you noted from 2019 the cost. So we're committing to building 4 houses over the next years, and we don't know what the market will even be like. My other concern, I have several other concerns. When you build these homes, will the contractors and the building providers, the providers of materials, are those going to be Meeker County companies? Or will those be companies that we are supporting outside of our county? Who will those contractors be?
Okay, you had more questions, I was like, I didn't want to
Yep.
interrupt you.
No.
So, contractors, for sure, we worked with Zach's my construction manager. What's the company? Whoever your lumberyard is.
Yeah, Litchfield.
Yes.
Perfect.
So we try as much as humanly possible to stay local, unless there's some version of reality. We work with Chapel out of Wilmer, and so they generally donate the HVAC and the plumbing, so it makes sense for us to go through them. But we are not above asking your local folks if they're in a position to be able to donate some of that. Carrier's a furnace company, they generally are able to work with us regardless. So if we have an HVAC company who's willing to do the paperwork with us, we can get that furnace donated. So try to save money where we can, for sure. just to jump back to your market concern for just 1 second. So we are open to buying on the open market. We certainly can do that. So if there's a house that, and we generally talk to the realtors in the area, if there's a house that is available, that it makes sense. The only caveat to that is we're putting in affordable home ownership, right? So these folks generally don't have a deep savings account. So when we move them in, we want to make sure we set them up for success for at least 10 years, guaranteed, right, as much as we can. So, meaning all brand new appliances, roof, shingles, windows, siding, everything that we can help prevent from being a huge burden to them, at least for 10 years. The thought process there is hopefully once they stable out and they live in that house for 10 years, they've hopefully been promoted in their jobs, right? We've set them up for success long-term. So life hopefully looks a lot different for them in 10 years than it does today when they move in.
And just to kind of add something too with the question on the market changes, I think the other thing with the Habitat approach is that, you know, they're gonna build, so 1 home per year. So they'll be able to develop a home, understand where the market is before they would make the decision to go into the next one. And so in the end, we'll have the information within our, documents with them that if they decide, for instance, after the first home, like, we're just not seeing home buyer interest, the market has changed dramatically, those protections will be in place that either the SAHA dollars won't get used because there won't be the full for home buyers, and the construction financing will then come back. So those protections are kind of in place that, again, if the market changes, like, our funds will be protected and repaid as part of that, or just not used because they're not gonna fulfill the 4 units.
Yes, absolutely, we're committed to that. I mean, if we can't put a homeowner in it and set them up for success, then we would not build at that point. So hopefully the market turns a little bit, but in the event that it doesn't, I mean, I am not above pulling the e-brake and saying, we can reallocate those funds because it just doesn't work at the moment.
Here's my final concern. I'm hearing from my constituents, I don't know about the rest of you, but they are exhausted with funding things, with taxes, high taxes, and funding projects for other people. It's difficult for families to survive on their own income. While this is a small amount and it's from SAHA, we're still asking taxpayers to pay for homes for other taxpayers. And I have concerns about that. I'm hearing people wanting us to stop spending money, not continue to fund things. And I would be more prone to support, I believe Habitat does wonderful things. They're a great nonprofit organization that is funded a lot by donations and work by people, and I believe that's how they should be funded, not by more government dollars. When we have government dollars already in place, like down payment assistance, FHA, USDA, VA, rehab loans, all those are available for homeowners to work right now without Habitat to Humanity. And what you do can help other people as well. But I don't want to continue spending taxpayers' money to pay for other people's projects. That is my concern, and that is the concern I'm hearing in the community regarding state taxes, federal taxes, and local taxes. And so, that being said, I'm going to have a hard time, even though it's a small amount, throwing more money at other people's wants. That's my concern.
So SAHA's already been allocated, correct?
Yes.
What happens if we do not use these funds for this?
They get returned.
They have to be used for
Okay.
affordable housing.
They would go into a regional pool.
Okay.
If they're not used within 4 years, they're used within a regional pool that can be used within our region that I think is probably dictated by the state at that point. It's not by us.
Great, for people who absolutely need housing, who don't have access to other federal funding.
But it would still be for the same purpose, which is to promote the development of housing units, affordable housing units. So whether that occurs then in Meeker County or other counties, like it doesn't then go and be used for supporting down payment assistance or something like that. It is for the development of these units. So it's that same type of project that we're talking about here.
So we're spending tax dollars.
Yes.
They're spent.
They're spent.
They're spent, basically.
Okay.
Anyone else?
Well, you two sit on the EDA, have you discussed this?
We have, that was one of the concerns, was the whole issue with how much the houses are and the amount to qualify. It was discussed, but I think it boiled down to that same issue, is that we either use these here or they'll go elsewhere. And it's not really gonna change what our obligations are. Is that accurate, Steve?
Well, I think you touched on it pretty good. I think it's, I don't know, Lisa, whenever we have these programs at the EDA, it's always a tender subject, if you will. I mean, it's weighing out what the economic impact in the long term, is usually what we end up looking at. I mean, it's less than attractive in my mind, I mean, up front. But in the long term, I mean, is usually where we end up coming to a consensus that, you know, it will put people in homes and the dollars are spent. They're, you know, as far as returning them or whatever, it's not like they're going back into the checkbook, you know, tax people less at a different time. And it's really not, the dollars aren't I mean, county tax dollars that we're imposing. So, I mean, really, when we have these conversations at the EDA level, it's always a challenge. I mean, we have a realtor sitting on the board that had very similar concerns and conversations. But I guess, as far as, the market changing in the course of the next few years too, I mean, I think we've seen that. I know UCAP at one point, I mean, that COVID, there was definitely some shifts in programs, and I'm sure Habitat was affected by that too, when things kind of, the markets tanked and everything shifted that drastically. We had to change some of these programs or cancel some housing and different things, so.
You brought up UCAP. If you recall, we had a five home project there. I think some got done in Eden Valley and then the funding went, we didn't use the rest of the funding. We said, no, we can't afford to do it anymore, and we didn't use it. So.
Is the one long in the tooth here, as they call me. I've gotten more calls about how we use our tax money in the past year than I ever have in the 10-plus years I've been on. So I understand what Cheryl's saying. When I look at these incomes and think about $300,000 homes, I'm like, that made no sense to me. I understand what you're saying. But, and I agree. Habitat for Humanity has been a wonderful organization. I've worked at the Legion. We donate, we support it. And it isn't a lot of money. However, as a board, this goes on all the time, just a little bit here and a little bit there and a little bit here. And I think we made a decision when we did our budget that we can't keep doing a little bit here. We actually have to start paying some attention. And it's nothing about the organization. It's the way of the world right now, and the way the state of Minnesota is, and the position that this county and a lot of other counties have been put in. And taxpayers are tired of it. I'm very glad to hear that we're using local builders.
That was good.
Certainly is
Excellent.
important.
Yep.
So I understand fully what Cheryl was saying. I sure do. So.
Yeah. No, it was a lengthy conversation at EDA too.
It was.
I mean, at some point, we have to say, you know, enough is gonna have to be enough, I guess, sadly. So.
I think Steve made a key point, though, two key points. One, if we don't spend it in Meeker County, can Ohio County get another project? The second thing is nothing's going back in the checkbook of the taxpayer because it's already there. So this is becoming difficult for me because I'm thinking, yeah, I agree 100% with what Cheryl says. We can't keep spending, but by the same token, I don't wanna see it go someplace else either.
Well, that's kind of like what I hear from a lot of people when they say, well, we gotta get this grant, we gotta spend it all, because if we don't get this grant and spend it all, we're gonna lose it. It's still taxpayer money, isn't
It
it?
is.
So, I guess
It is taxpayer
it's
money, I agree.
taxpayer money, no matter where it comes from.
There's no
So,
doubt.
And and if that money goes back somewhere else, it could be used for a purpose that there's greater need than this purpose. I don't believe that a $300,000 home is entry level.
I don't either.
It isn't affordable. Not today, it isn't. And if something should happen to the market where it regresses, and you have a homeowner with a $200,000 mortgage and a $100,000 silent mortgage, and they need to move or sell, and the market is lower, how can they do that? They're stuck.
So, and when you talk about houses that Cheryl mentioned are on the market for less,
Much less.
when you say you're setting them up for success, shingles, right, that's important. Do they have to have different inspections from when, if I went and just went to my lender and said, I want to buy this house down the block here and I need to borrow X amount, and they look at it, they have a standard, like they'll say, I know shingles are a big deal now, but certainly they don't look and say you have to have new windows and you have to, I mean, is that just a standard for Habitat, or is that a standard? Do you know,
We
if you
order an-
understand what I'm saying?
Yes, yep, so we order an inspection just like you would, so whether
So
you're
it's the same,
for-profit, nonprofit, yep,
it's the same
affordable
standard.
housing, not market rate, I mean, same inspection that everybody needs to go through.
Okay, good.
I would say, and maybe we both can talk about that, I mean, the SAHA funds are locked down. They have to be used for affordable housing only. There's no other option. I mean, when they roll this program out, I worked on the legislative side of it. I mean, it's very black and white. It can only be used for affordable housing. We allocated it to rural, like you talked about, more than the 7 counties in the cities on purpose, because a lot of times when we would appeal to like Minnesota Housing or Greater Minnesota Housing Fund for grants and funding that way, Meeker counties or Candy Ojai County, right, I serve 5 other counties in the area, it's hard to check all their boxes that you get your points for, because we just don't have an Uber out here. You know, we don't have public transportation the same way they do. We don't have access to, you know, whatever level of hospital that they require. You know, we just don't have those things. So this program was meant to be very specifically meet that need. So if that helps at all. So yes, state taxpayers' money, yes, but not like from the city side of things.
Not like
You know,
what?
or the county side of things. It's not laid out like in your budget.
No, I understand.
Right, we understand.
Understand that.
Yeah,
Absolutely.
so I don't know if that's helpful to explain, you know, if they do call to ask questions about it, to just say, the money's already been allocated for affordable housing from the state. It has
Right.
nothing to do with it.
And to be clear, those SAHA funds don't have to be given to Habitat for Humanity, and they don't have to be used for new construction,
Correct. Yeah, they just have to be used for affordable.
affordable housing.
There's that word affordable.
I know, and I'm sorry, but I just can't.
Well,
When
there
we
really-
have
there
houses
really
on the
isn't.
mar- We
I
have
know.
houses on the market for
No,
under
no, I
250,000. Those are more affordable than a $300,000 home. So I'm,
And like I said, we're not opposed to looking at those either. You know, if there's a home on the market for
Okay.
$250 that has,
so then,
checks all those boxes to be sustainable for 10 years, where we could,
so that could be revisited for that. This could be revisited for that.
yeah, yep, so it could be, in my mind, it's DPA set aside for homeowners. Maybe we need to rephrase that word in there. For families. I mean, it doesn't have to be new construction. It could be, or we can look at homes that are here that check all the 10-year box.
What we're working on today, though, would be approving this funding for 4 new homes. That's what is on the table today.
Yes.
What does it say?
Could it say for homeowners? Could we do that? Would that be?
I think I would like to make a motion to table this until we have some further discussion.
And I would just say, our discussion at EDA very much went like this. And at the end, we approved it to move forward because we were only a part of it. And and probably to be fair, in my terminology, we basically punted it to this board.
So maybe,
for further discussion.
maybe if
So I
we-
mean,
if we change some
it's not-
wording, maybe that would make a difference. I don't-
Yeah.
So Cheryl we have a motion on the floor to
Yeah.
table this. Do I get a second?
Should we get some more information? I think that,
Yeah, I
So
think
I will
that's.
second her.
Okay, and I have a second. Any more discussion? All in favor?
Aye.
Opposed? Motion carries. So maybe you understand what we're talking about, Lisa, here.
Yes. Could we get some further guidance? Like, are you thinking a work session? So tabled for future discussion, what do you want from us in terms of to help that future?
Well, I certainly would like us to not just say it's gonna be building homes. If there's something on the market, I think if we change that word to homeowners, or would that help? Cheryl, it's kind of what would you like to see? Because
I would rather not use more taxpayer dollars to fund this. I feel like there are already considerable programs
Okay.
available.
Okay.
And so I do not want to
So-
increase funding. We are already obligated to 45,000, if I'm not mistaken.
Okay.
Yeah.
But we've tabled it now for more information, so we
Right.
need to provide them what information
Yeah,
we might
so,
like to
that
have.
45,000, I think, should be used for the purposes that we've already designated, and if that can be used for rehab, fine. I don't,
Yeah, us EDA approving the 45,000, knowing it's not going anywhere unless we approve stuff. So I mean, that,
Well, and I think the 45, we're talking about, I think, two different 45s.
Yes, we are.
We were talking about the 45 that was originally allocated for the Habitat for Humanity
Right.
projects versus the
Yes.
$45,000 construction funding.
Right.
And so I guess the question is, what information would help you make that decision of whether or not to increase the allocation to 60,000? Or do you just want more time to think about it? Do you want us to come back at the next regular board meeting? Do you want a work session discussion to have a longer long
I will
conversation
tell you,
about
for
it?
me, some of this information that I listened to from Cheryl today, if you can find a home on the market for less than $300,000, it just makes sense to me to try to get people into that. So if that's a wording change, or you're doing that anyway,
Just to clarify on that for one
Sure.
second. I'm stepping in for that subsidy, or Habitat is, right? But I'm the one who's doing all the fundraising, so I'm so happy to find a house for $250, because that's
Yeah.
$50,000 less.
And I'm not-
So
right.
just to clarify, just so you know.
I
my intention
understand.
behind
This
it.
isn't
All
about,
day long,
right.
I
This is
don't
not
think-
about the organization.
no, not at all.
Absolutely not.
Yeah, I just want you to know that.
Yeah.
Totally feasible, and you and I can talk, Cheryl, like, if there's a house on the market that makes more sense, we're not
Yeah.
opposed to that. in any
If you
shape
open
or form.
Realtor.com and sort by price, there are plenty there's a house in Grove City. There are several in Litchfield. There are homes for sale. And there are already government subsidized programs to fund those. And so if you can fund your organization with charitable contributions, and I greatly appreciate the sweat equity, all those things, that's great. I don't want to fund any more. I don't want to send any more taxpayer dollars to fund that.
Okay.
That's,
So I guess if the
but
what-
change
what
my
I'm-
mind.
What I'm hearing though is that there's not really a desire to have from what you're saying, there's not a desire really to have further conversation. There's a desire to just not approve it.
That's probably
And
fair
so-
on my part, but that might not be.
And so, I mean, from the rest of the board, then I guess I'm looking for that direction of what other information are
Well,
you
what
looking
I
for?
just said would be important to me.
Okay.
right, the
That we-
flexibility.
The
of-
flexibility of what we're looking at, that we're not just gonna put up a $300,000 home. That's important.
Can I ask a question? What would you want the SAHA funds to be structured in a perfect world in your?
Where should those go?
Yeah.
I think, the other notes about where those funds go to, the housing, HRA, I believe. I don't, that is, there are very needy people in our society that don't have housing, that can't go get a loan for a house at all. If you have a constituent who needs a three-bedroom house, there's a three-bedroom house for sale in Litchfield for under $250,000. There have been houses on the market for 210 recently that are just under contract. They can go get a loan for that house. They can get down payment assistance, and they can purchase that house. there are people who cannot, they do not have housing, and sometimes they're elderly. And so perhaps those SAHA funds could be used for facilities that would support that.
And just to be clear, like with the HRAs, so that what's worked is, again, you can use the funding with HRAs for like renovation of units,
Right,
construction of units.
yes,
You can't use it just for operational support, like.
Perfect.
yeah,
Yep,
HRAs.
absolutely.
So it has to be kind of that.
Yep.
Renovation,
yep,
housing creation. Yep.
right.
So, go back to this. We made a motion to table, so where do we want to go from?
Well, we've tabled it, we've voted.
It's tabled.
So could, maybe as we think about it as commissioners, could we then get it, questions we have that we'd like answered to Andrew, who could then get them to you?
Yeah.
Rather than sit here right now and try and come up with
Perfect.
our questions.
We might
I mean,
vote on it and let you know when. Does that make sense?
I think what we'll do is we'll plan to bring this back at the next regular board meeting. Give
That will
us
be fine.
3 weeks then
Okay,
to consider this and.
yeah.
that's what we'll do. So, thank you, ladies.
And who's your punter?
Well, it really did. I mean,
It
for,
was, yeah,
for
it was-
EDA, it's like, we can have this discussion here and move it into the board, you know, approve
This
our part,
here
which
that's
ain't
on
going
the
anywhere without board approval here. So I mean, it was,
That's correct.
but the conversation was very
Trouble,
simple.
and I have for years.
No, I was just giving you a bad time.
No,
The buck has to stop somewhere.
Because we realize in 3 minutes we're losing you.
Okay,
Yes,
let us move forward.
which means somebody else will have to share this.
I asked Paul to do it. I gave him the script and stuff, if you don't mind.
It's, yeah, it's in
And here we have Mr. Greg Schultz, Land Use Records Director.
Morning, how we doing?
Well, we're fine.
First item I got is zoning, planning commission zoning ordinance changes. This is an edit from our work session where we pulled out those 5 items to be discussed later with the planning commission meeting. What you have now is, I think you got an edited version of the.
I'm gonna have to ask you to speak up a little, Greg.
Okay.
My ears are, I'm getting old. There's just no way around it.
So now we got 29 items, where we had 34 items.
So the other, what we talked about is not in here. Okay,
Correct.
okay.
Solar ones, the feedlot ones, and the rezoning ones were all pulled out of there to be discussed by the planning commission at their April meeting.
So they're gonna go back to April and, okay,
Yep, correct. We were gonna have a meeting tonight, but we had a shortage of members, so we'll push it to
Okay.
April for discussion.
that's fine. All right,
So the first 8 items, actually the first 6 items are all about, extending our timelines on permits from anywhere from 6 months to 12 months to everything being standard 18 months of the permit expiration, as we discussed in the work session. And that's basically for contractor issues and things like that, to get the work rolling within 18 months rather than 12 months for a lot of these permits. The next item, item 7, was just an additional language to myself, the zoning part of the county, to be able to call on county attorney and sheriff's department when needed to enforce some of these zoning ordinances. That was number 7. Number 8, permitted uses, that was an E1 district. Had a couple of things, just adding verbiage, like telephone, fiber optic, electric distribution, gas distribution, water distribution, that was for essential services. And then part O of that A1 permitted uses would be, take out the road and contractors, just have small contractors in general, would be able to be permitted in the A1 district to have it in their property, in their proper property. Next item, item 9, was the conditional use part of the A1 district, and that's just, I was adding the square footage on various businesses to allow for a larger workspace for these businesses when they come in. And also to expand on the, in part O of that, expand on the actual verbiage on exactly what can happen for wood product manufacturing, building material sales, stuff like that. FF was adding floor shops, plant nurseries, garden supply sales to be allowed in the A1 with a conditional use permit. Restaurants, country stores were added to that A1 conditional use permit. production, processing related to agriculture or building industry. Also, we're gonna allow that with a conditional use permit to be spelled out more clearly. It hadn't been spelled out in the past in the A1 district. Interim use permit, the only change there was gonna be A1 district, we're gonna add the cannabis cultivation there. Since we're gonna be later on down the road, we're gonna change all our cannabis related permitting from conditional use permits to interim use permits.
Good luck, Commissioner. If you see the ambulance backing up to the door, that means you didn't pass and you'll be on your way.
I don't hear the helicopter.
We will know.
As long as it isn't the hearse, we're all right.
Well, that went
Sorry,
south.
Greg.
So, and then section 11A1, we're just gonna push back the feedlot setback zones from 1,000 feet to 1,320 feet. That's for class A and B feedlots. And then in section T of that, we added data centers to that language, to not only just wind energy facilities and data centers. And then we also put in the A1 district that at this time, Meeker County wants that data centers will be prohibited in the A1 district. We haven't had any inquiries, but if it happens, we'll push them to industrial commercial districts, if that happens at this point. So we don't have enough information on it yet on it, so. Then with section 14 was a C1 district, conditional use permits. We're gonna add a couple items there for apartments above ground floor of retail and commercial businesses. And also data centers need to provide, if there is a data center that does happen to apply in the commercial district, we just kind of put some language in there saying how they're gonna have to give us enough data, show impact local infrastructure, will meet additional local, state, and federal regulations as they are created. Section 15 is in the industrial district. Again, we put the data center language in there. We'll need information on how it will impact the local infrastructure, and that's the same as in commercial districts. Section 16 is dealing with the shoreland district, and that is to change our guest cottage houses from 700 square feet minimum buildable to 800 square feet, which meets our building code standards of 800 square feet minimum for a new dwelling in Meeker County. So number 17 is essential services, adding some verbiage to that to adding rebuilding in addition to expand the explanation of what's allowed for essential services. Section 18 is for septic systems, and we're going to require more inspections for inspections in the shoreline district, as well as any time that a bathroom is added, which is something we didn't have in our ordinance in the past. You have to have a mandatory compliance inspection, since we found there's been some holes in it, some have been missed in the past. So that just kind of adds that bathroom item to be added to our settings. An additional, and that's for that section there. Then we go into section 19, that's all dealing with section 19 through section 25, 26 is all dealing with cannabis. And that is, in the first part of that section, we're taking out all the permittable language that we currently have in the ordinance and changing it to non-permittable except for cannabis cultivation in the A1 district. So that'll push all the other parts of the micro business, meso business, manufacturing, the wholesale, and all that will be pushed to the commercial districts or industrial districts. And change the retail hours to the maximum, the minimum hours permitted for retail hours will be from 10 a.m. to 9 p.m. Mondays through Fridays and 11 a.m. to 6 p.m. on Sundays. That's for retailers. We changed the hours. We didn't really have hours specified in our old ordinance. This one spells it out pretty clearly for them, what they can operate for the retail hours. And then the cannabis cultivator business went from CUP to IUP, but also we added in that one that They'll allow packaging, labeling, and warehousing of cannabis products that are only grown on-site with the allowance of transportation and other cannabis businesses. So what that means is that cannabis cultivators in the A1 district can package only the products they grow on their premises. Doesn't allow bringing in outside products to be processed, manufactured, and warehoused on those sites, so. Okay, the other ones are 23, 24, 25 are all changing the conditional use permit to an interim use permit, so you have greater controls on what happens with those permits down the line. We can put time constraints on them, and if ownership changes, things like that, it doesn't just run with the land forever. We have greater controls. If ownership changes, we'll make that new owner go through the same permitting process as the previous owner. So that's a change there. Number 27 is the guest cottage. We changed the square footage on the dwelling portion of that one. That's our definitions portion. And section 28 is a definition of, we're spelling out what the holidays are gonna be for interim use permits and CUPs to spell out our, the following, New Year's Day, Easter, Memorial Day, July 4th, Labor Day, Thanksgiving, Christmas Eve, and Christmas Day. That'll be our standard holidays for those types of permits. And the last one is mini storages. The buildings, we're changing the square footage from 5,000 to 12,000 square feet. And eliminating the two maximum allowable storage buildings to be kind of open-ended to a maximum square footage due to the change of people using storage containers as well as accessory buildings on their properties.
Questions?
Our county attorney, Schiefelbein, has reviewed these and they're in compliance, so we're not.
Correct.
Okay, thank you. That was my only question.
Anybody else?
No.
If not, I look for a motion.
Madam Chair, I move to approve the recommended changes to the Meeker County zoning ordinance.
Do I hear a second?
Second.
Second. Any more questions? All in favor?
Aye.
Opposed? Motion carries. Thank you, Greg, for taking care of that.
Thank you, Greg.
Land Use Records Annual Report.
So with that, we'll go to my departments. So within the land use department, we have the following departments: planning and zoning, building department, septic department, GIS department, we got the landfill solid waste department, and the aquatic invasive species department. We got all these things. Zoning really didn't start until 1915 in New York City, just kind of a little history of it. That current zoning ordinance in Meeker County was adopted in 1992. Zoning includes both written regulations and maps showing different zoning classifications in the county. Minnesota state laws allow counties such as Meeker to have zoning ordinances and sets parameters for local regulations. The authority in Meeker County is divided amongst Meeker County Board of Commissioners, Board of Adjustments, Planning Commission, and Zoning Administrator. So County Board of Commissioners, as you all know, are 5 members. Board of Adjustments is a 3-member board. Planning Commission is a 7-member voting board, appointed by the county board. And zoning administrator is a county staff person responsible for interpreting and enforcing the zoning code. And also bringing applications and information to the various boards for their review. There are basically 6 main zoning districts within the county. A1, Agricultural Preservation District. Primary purpose of the A1 district is to conserve and enhance agricultural land which has historically been tilled. We have the R1 Suburban Residential District. And that allows low-density residential development as an orderly expansion of existing urban residential development where urban services can be readily extended and provided. We have the R2 Residential District. That's allowing larger lot residential development and utilities where urban service cannot be economically extended. We have the C1 Commercial District. It's accommodating certain commercial activities not compatible with the predominantly retail uses of urban areas of grouping together those uses which require accessibility to roadways. C2 district, neighborhood commercial district, multipurpose, allowing retail and general commercial uses in existing small incorporated urban communities. Then we have the I1 industrial district. This is allowing limited industrial adjacent to existing urban areas on or allowing next to major transportation routes. This map here kind of shows this is out by Walmart, it shows the different zoning districts and how they interact with each other. You'll see the brown that's north of Walmart, that's a residential area. The green is the A1 district, agricultural district, farmland such. You have the blue is commercial. C1 district, that's that truck shop that does truck repair out there, DC diesel. And then you got the gold or the orange looking, which is the industrial district, which is the junkyard out between Joe and okay. We also have a couple other districts in the county, shoreline district, which is in 1,000 feet of a lake or 300 feet of a river. We have the urban expansion overlay district. We have the wild and scenic river districts, which is the North Fork of the Crow River. Then we have watershed districts. Some examples of the rules of districts to allow residents of the property include planning within R1 and R2 districts. Building eligibility requirements are within only the A1 district, and property splits and combinations which could occupy any of the districts. Planning and zoning through the Planning Process Commission and the Board of Adjustments issues on average about 36 land use permits, 21 variances, 29 APs, and CUP, 6 rezones and 4 plats a year. Our building services department is the first one we'll look at. That's currently staffed by Brian Fehrenbach and Monica Ankrum. In 2002, we adopted the building code in the county. So by agreeing to this code in 2002, the county takes on the responsibility to inspect and enforce building code rules for construction projects that need to meet our building code requirements. So this is done by various different inspections such as verifying setbacks, property lines, verifying plans, making sure on paper construction is acceptable to codes before construction starts, investigates building code violations, performs on-site plan reviews, conducts construction inspections for proper building techniques and structural integrity. It also inspects buildings to be moved within the county, issues building permits, issues citations and corrective orders, and all these are done to ensure compliance with the applicable building code and zoning ordinances. Currently, Meeker County has entered into agreements to inspect utilizing the county staff for the cities of Dassel, Grove City, and Cosmos, with partial agreements for accessibility for Eden Valley and Watkins. Building department averages about 350 building permits a year over the last 16 years, and has moved up to about 423 in the last 5 years. We had 517 issued permits in 24 and 414 in 2025. That was due to the storms that passed through in 24, basically, repairing those from maintenance issues. Currently in 26, we've issued 35 new permits, which is about the same as we issued at this time in 2025. The difference is in 2025 at this time, we had 1 house permit at this time. Right now we have 4 new house permits. So that's, I think, a good sign.
That's great.
Last year, since last July,
Do you know how many new home permits we have per year? It says 4, that's so far this year. Do you know what the total was for last year?
I don't have it with me, but I do.
Okay, but we're seeing an increase in new housing starts, do you
This
think?
year.
This year?
Yeah, compared to
Okay.
last year.
Okay,
Yep, exactly.
thank you.
So, and then since last July, as you all well know, Jim Chews had gotten sick. Brian, our building inspector, has been taking over for the city and has done the inspections for the city. So that is still taking place right now. we'll keep going on until the city decides to hire a building inspector. This time they still don't have it in the works, I don't believe, to hire one at this time. And we haven't advertised, so, and Brian is doing a fine job with that. Last year, in 25, he inspected 167. And 167 locations in the city he inspected on top of his county work. That was in 25. So I suppose it's gonna be on pace with this year. The difference in this year is that there's the hospital coordinator had said the hospital expansion is happening. So with that, Brian has got the plans for the new hospital addition, and as well as another large possible business in town that wants to expand. So with that, he will be doing, between himself and the state of Minnesota, the state of Minnesota will do part of the inspection, and Brian, our county inspector, since the city doesn't have one, will be doing the other inspections. That's all for that one.
If I can ask Greg, is he overwhelmed? Because, you know, we had once, maybe a couple of years ago, we talked about, could one person do city and county? So which brings me to the question now, when you talk about this, is he overwhelmed? Is this something that we could get by with, you know, between the city and us, a full-time and a part-time if it's available, or?
There are times, especially in the summertime, when he is running
Oh, yeah.
nonstop.
You probably
Right
weren't
now,
aware of our
spring.
last discussion.
He's not out so much, very manageable now in spring, winter time, very manageable. But there will be a time, probably May, June-ish, where he'll be out probably constant 8 hours, nonstop. That doesn't give him much time to get back and do plan reviews, which is part of the job too. And this hospital expansion, he hasn't really seen the plans yet, fully yet, so that's still coming, so that'll take a lot of time. It'll take a lot of desk time to go through those plans for the hospital.
Yeah.
I think he's been notified by the state what he's gonna be responsible for, and what the state's gonna be responsible for, he hasn't yet seen those plans yet. It'll be pretty large.
Yeah.
And with that, you know, the city doesn't have, that would get some of the building permit, but we, because he's the planner, he'll have to do the plan reviews, the county will take that fee. And the county right now takes all the plan reviews for the city as well, because Brian is the one certified to do the plan reviews. So we take those fees on top of a portion of his inspection services as well.
And the city builds their fee based on the cost of the project.
Correct. And they've now, since Brian has taken over, they basically use our fees. Jim had a different system than Brian, and we use it the county. So now the city uses our fee system rather than what the city had used. So it's been a transition there between us and them, trying to figure out how we're gonna handle it compared to how the city handled it in the past. But for the average citizen in the town that's got a building permit, it goes pretty smooth. We know what, put the fees on there. Part of it goes to the city, part of it goes to us, and then we charge back the city on the inspection. Number of inspections we have for those permits to the city, so. So that's the building side. Just an example of what building plans that Brian's looking at when he gets plans in place. Some new structures. Next department, we'll talk about the septic department. That's with Brent and myself. This is a department that the number has gone down a little bit over the last few years, particularly with not as much real estate changing hands. So not meeting the requirements of having compliance inspections on that, so. And, you know, overall average, we average about 120 permits a year. Just last year, we just issued 93 permits. We approved 111 designs last year. We only installed 93, which is down. So our average now over the last 5 years has gone down from that to probably, you know, it's less than 120 now. We want to get an average probably like 115 now in the past 5 years. Just some pictures of septic tanks on the left. That's a pressure bed mound system, the guts of it, before it gets covered up with soil on the right-hand side, as you see, with the laterals, distribution of rock underneath it, the distribution area. Next department has the geographic information systems, that's staffed by Teresa. She does all our mapping, our GIS for Beacon. She helps out with the sheriff's department and other departments. Emergency management for their needs as well. She helps out a lot with the auditor recorder and property splits when they come in to kind of get that remapped and put in our system for verification. Latest project she had completed in 2025 was a grant from the state of Minnesota to do quarter sections with a couple other townships. So Doug Hune from North Star Survey, along with herself, have graphed and put it in her system, the GIS system, all the quarter section pins for Dassel Township and half of Collinwood Township for 2025. So there might be more grants coming in the future, similar to all our townships, but those are the first two that had a grant for this type of project. So if you go to our mapping on GIS and have a look at all those poles, all the points for the properties in the different districts, she maps all that out and puts that in her system. Tries to get it up to date as quick as possible. It usually only takes a month or so to get through the system, get through the audio recorder and all that, but it's in there pretty timely. Next one is our AIS department. That's staffed by Ariana Richardson. She's a part-time worker for us, and currently we get about $226,000 in state grants just for AIS. It can only be used for AIS, nothing else. And that's for the inspection services or other type of program, or education program, things like that. 2027, I think it's gonna be, sounds like it might be cut in half. We still don't know exactly for sure. We use approximately $60,000 a year. It's at least budgeted in our balance fund of unused funds to be added to the AIS current grants to run the program every year. I think it's been less, and we allocate 60, but I think in reality it's, I don't know, we've used like 40,000 in the past, I believe. So if our grant money does get cut in half, we'll have to grab more from that balance fund to offset that, or otherwise we'll have to change the program, which is the AIS committee, you know, Paul's on that one. I think we've all discussed it. There's gonna be changes in that program come next year. And what's gonna be funded and all that, and yeah, so that's something that they'll have to look at pretty serious this year, see how it's gonna be managed next year. So this AIS position, Ariana, she works a lot with lake groups, monitoring and mapping aquatic plants and develop native plant protection and tries to develop strong partnerships between lake associations and lake property owners, tries to get a volunteer network going, things like that. It's a pretty active group, the AIS group, as far as trying to get lake associations on board and stuff like that. See the picture on the left, that's some examples of aquatic invasive species. That picture on the right is a mobile decontamination unit we usually have on the west side of Lake Ripley. Has an air compressor on there, it has a vacuum, it has some other things so people can kind of clean their boats up a little bit. They pull it out on the west side of Ripley. They don't choose to use it. We have a larger decontamination unit that is permanently housed on Lake Minnabell, and that has a steam cleaner as part of it. On hot water on the outside of the boats, and there's some tanks to kind of sterilize it from aquatic invasive species that can be hung up on the framing around the boat and some of the tankage of the lakes as well. And that is, and Lake Minnabell also puts a fair amount of money into this program along with the AIS program to staff a decontamination person there during the busy hours of the day on Lake Minnabell. So that's part of the coordination that Ariana sets up as well between the lake associations such as Minnabell. Next department is the landfill solid waste department. That is staffed by Brent Radke. He's our hazardous waste administrator, or solid waste administrator, I'm sorry. And then we have Tom Downs, who is a part-time Caterpillar operator out there, Monica and myself. All county employees are considered part-time in their duties at the with the solid waste department. Brent, this is a part of his description, part of my description. County department also manages the county's recycling sites such as SCORE funds by coordinating and assisting municipalities and waste operations with the recycling programs throughout the county. Currently, out at the site, we have a third-party company called MWS Logistics. They had bought out Endurance Environmental, who was in last couple of years, and run the site out there. So now it's MWS. We approximately get about 15,200 tons of mixed solid waste a year. It comes to the site 5 to 6 days a week. Eventually ends up to Spruce Ridge. That's the facility in Biscay. And then our demolition site, recycling, upkeep. We have a site transfer facility that's managed by part-time, as mentioned previously. So this is a department that's very fluid. You can kind of run, you have to shut down and open up according to weather, sometimes equipment failures, things like that. Yeah, it's been interesting. So we've taken it over since 2022, I believe. So here's our current transfer station on the left, and there's a demo site with the cat breaking down the demolition waste at our demolition site. Additional department information, the land use group, we also work closely between the assessor. We basically work with the assessor for updates, properties, and their assessing crew out there go on sites and does site visits. They'll let us know that if there's new structures up on site, if there's old, they'll let us know if old structures on site have been removed. We kind of look at that, property records from property splits, combinations, and historical information with the treasurer for landfill expenses and billings. Work with the highway department for right-of-way questions, things like that. EIS, equipment maintenance, they've helped us out with that as well at times. And the county attorney for enforcement and ordinances and billing, as well as other legal questions. So a little bit of a brief description of what we do in land use.
Appreciate that. Thank you.
Questions, anybody?
Nope.
Thank you, Greg.
Thanks, Greg.
You want to take a quick break, or?
So I was just looking at the agenda. Should we wrap up that last resolution? Because that's
sure. Let's
that's
do
a short one. And when we come back, you can go right into recessing.
Yes, sir, you can do whatever you wish, because
I'm
you're in
just-
charge today. That's just fine, Paul.
2 days.
That's fine. I'm
Oh,
kidding.
just making
No,
a
it's
suggestion.
fine, it's fine. So, Devin, good morning.
Thank you for your patience. We're running a little behind.
Are we ever? I am really, I've got a busy day, too.
So this is just updating our resolution for judicial ditch 7. There was one made in 1991 and then updated after some redistricting in 2013. There's a few errors on it, and Candy Ojai didn't have any resolution on file, so they're gonna be at the same time we are. So this is just bringing everything up to date with redistricting and stuff like that, so.
Madam Chair.
Yes.
Move to approve the resolution appointing Meeker County Commissioners to Joint Drainage Authority for Judicial Ditch 17, Meeker, Candy, Ojai.
Okay, do I hear a second?
I'll second.
Corey? Or any discussion, questions? No? Corey?
Commissioner Van Ort?
Yes.
Commissioner Johnson?
Yes.
Commissioner Samke?
Yes.
Commissioner Olberg?
Yes. Okay, thank you. Shall we take a quick break?
That would be
I
great.
would suggest adopting a motion, go into closed session, and then we can take a
Okay.
few moments to walk over to room 201.
Okay.
You want to do the closed session before we do the joint
So we
ditch?
need a motion to move
We
into
need a
closed session.
motion,
Separate
yeah,
meeting.
I
It's
thought
not
he'd have it
The
up
county
there.
board
but-
meeting.
Okay.
Madam Chair, I so move
All
that
right.
we move into closed session.
Second.
Close.
Motion to move into closed session pursuant to 130D.05 subdivision 3B, attorney-client privilege, to discuss matters related and pending to veterans preference hearing.
Do I hear a second?
I'll second.
All in favor?
Aye.
We're in closed session.
Well said.
And the only item that we'll be discussing in closed session is related to the subject of our closed session.
Absolutely. Okay.
So,
Quick
can we, can we detour on the way, or do we want to go?
Yes, you can
straight
detour on the way. We're
I
gonna
gotta
go
make
over
a
room
phone call, my
201.
phone has been burning.
So when you left before, were you just out of there?
I used the restroom, and then I took the opportunity to go talk
I thought
with
you were getting snacks.
He was, he just.
Sure, whatever.
Commissioner update today.
I'm okay with that.
Behind my schedule.
We already did
I didn't have much anyway.
I had was the EDA
I
meeting.
just have Prime West, really. And we didn't have financials at Prime West this time, for the same reason as us.
Madam Chair, we're on.
Thank you. All right, we're back into regular session. Paul?
Well, you're gonna adjourn us now,
Oh, yeah, wait a minute.
or recess us to,
I do have a lengthy administrator's
We have
report
to
I would like
do, we have to do Andrew first, right?
I have about 20, 30, 40 minutes to
I
go.
know you
No,
don't. I know you're
Just a
kidding.
quick reminder that we have a work session for next week. The topic is going to be on our opioid funding and a discussion of a plan for the use of those dollars. So that is my only report.
And I think we just, unless somebody's got really important stuff for the updates. And Boys and Girls County, a reminder, is April 21st at the American Legion. Get the details as we go. With that, I am gonna adjourn. I don't need a motion, you don't think? I will adjourn.
motion to adjourn, or are you just gonna do it?
I'm just gonna do it. The board
Thank
meeting,
you.
this board meeting is adjourned.
Okay.
Thank you.
All right, now let me.
All right. Our chair,